Hello and welcome to today's preview of our emergency documentation training session. Please remember, all of our materials are copyrighted. They are protected by federal law. They may not be reproduced. And of course, compliance is a responsibility that we all have to follow. If you have any questions, go to your compliance officer, go to your manager, or seek legal advice. Hi there, I'm Maggie Adams. It's great to be with you. Here is my phone number and my email address. If you have any questions after, don't hesitate to get in touch. We are bringing you some information about this session on emergency documentation, where we're going to discuss the essential components of compliance and documentation and help get your crews ready for ICD-10. Because documentation is going to need more information for ICD-10, which is the International Classification of Diseases. Everything we do in healthcare, we describe what it is by creating an ICD code. And we have up until now been using ICD-9 codes. Effective October 1st, we go to ICD-10, and every single aspect of healthcare, providers and payers, are impacted by this deadline. Every claim we submit, in order to describe what goes on with our patients, we need to have an ICD-10 code on it. And unless we have good information from documentation, we're going to be up the creek without a paddle, because we're not going to be able to create the claims that we need to create, which would ultimately come back and haunt your poor patient or be a problem for the organization. So this session is going to teach about compliance and documentation, the Medicare compliance issues, the medical necessity issues, and we're going to show you how documenting for ICD-10 needs is a critical step to help maintain overall compliance, and that maintaining compliance is going to make your ICD-10 documentation a whole lot easier. And this really is all about the clinical of what's going on. When providers document, and this is what this session will address, they document from the operational, the clinical, and the reimbursement perspective. So we're going to talk about how the call was received, and noting their mileage, and of course the clinical issues with the patient's condition on arrival, during treatment and transport, and the where, the how, and the what. Where did something happen? What's the history of the present incident? How did it happen? And what part of the body was impacted? And of course, reimbursement. Why is ambulance the only way a patient may be transported? Now, we see a lot of trips, and we'll see the kind of trips where it's documented as an emergency. Patient had nausea and vomiting. Or this particular call where the patient called 911 and the documentation said patient found sitting in a chair, and documentation noted edema of the lower extremities. I ask you folks, is that an emergency? Well, it could be if you had some more information. Was this a sudden onset? What is the history of this particular incident? What is the background? What is this patient experiencing any other symptoms? But to merely note that the patient had edema of the lower extremities doesn't explain what they need an emergency ambulance for. And as I said, we are graduating big time. Right now, there's 13,000 different ways we describe what's wrong with our patients. We're going to 68,000. 68,000 is a whole lot bigger than 13,000. And we used to have 4 blocks on our claims that we would note what was going on with our patients. We're going to have 12, and 12 is a far bigger number. So when you're looking at emergencies, you've got to be specific. Where did something happen? What is the mechanism of injury? Where did an event occur? What is the HPI, and how did it occur? And provide information from bystanders or family or caregivers, and what part of the body was impacted, the right, the left, the upper, the lower. And when we're looking at things like emergencies, a simple thing like a patient who fell from steps or stairs, we need to know, was this an incline? Was there ice or snow? Was it a ramp? We need to have specifics. Think of old Ralphie, who wanted a BB gun and practically shot his eye out. Yes, we need to know he was in the backyard and the BB gun was involved, and it was his left eye that was impacted by the injury, because we have about 286 different ways to describe abrasion when a patient's in an ambulance, or 263 codes for things that happen in a car. So we need to be as specific as possible. We need to focus on the where, the how, and the what. This session will bring your field providers the information they need and help them understand compliance. Thanks for listening. See you online. Bye-bye.